You mentioned also that schizophrenics output a certain chemical in their urine.
That's not only schizophrenics, other people do as well. That's called the Pearl factor. We discovered that in 1960. I can tell you exactly what happened. We were using LSD as a psychedelic treatment for alcoholism. That started in Saskatchewan. And we treated about 2,000 alcoholics in Saskatchewan over the period between 1954 and 1960. And one day it occurred to me that inasmuch as the LSD experience in alcoholics was very similar to the schizophrenic experience, maybe there might also be an identity biochemically. In other words, did the LSD create a chemical change in the alcoholic that was similar to what was present in schizophrenics? So since we were routinely giving LSD to alcoholics, I ordered a sample of urine taken, and at the height of the experience, which was 2 hours later, we took another sample of urine, and we sent the samples of urine down to our chemical laboratory for analyses. And they found, to my delight, that there was something appeared in the 11 o'clock urine that was not there in the 9 o'clock urine. And later we identified that, and we called it the mole, the mole factor. It was a pink factor that we didn't identify. And then we did a tremendous amount of study. We found that this was present in the majority of schizophrenic patients, but it was also present in many people with depression who were not schizophrenic. And it turns out today that this is a major discovery, and in Europe especially, they're using it as a major measure of oxidative stress. The mole factor is a major measure of oxidative stress, and there's especially in Holland, a large number of doctors that are researching that particular discovery. Now, we found that patients who had that factor, and this was in cooperation with Dr. Carl Pfeiffer, who was working in Princeton, we found that if you give these patients a large amount of vitamin B6 and zinc, you get much better results. So this became a way of determining what kind of treatment you should give these patients. So that's still, and some of the best labs in the States are using it now.